Wow, it wasn't. I don't know even because it was too emotional. The challenges was vomiting. I was vomiting a lot. But no, I'm okay. Yeah, I'm fine. Even I'm healthy.
We found out that among the people we are giving care or we are treating, most of them have a problem of cancer of the cervix and the breast.
I had my menopause 2 years before, so in 2017 there. So in 2019, in May, I spotted I was sitting, but I started asking myself, what is this? Then I asked my neighbors. There was an old woman who told me, you might be wanting to get pregnant again. There are some women who get pregnant. But I had heard about cervical cancer.
So patients need to put in the back of their mind that when they are referred for radiotherapy, they need to have a checklist. Where am I going to reside? What am I going to be eating? How am I going to survive? Who is taking care of me and where the caretaker is going to be? Also, when they come, they need to first unlearn the things they have learned about cancer.
In the heart of Kampala, life never slows. The busy markets, the crowded streets, and the struggles of everyday living. But beneath this vibrant energy lies a silent crisis that continues to devastate families across Uganda: cervical cancer. Caused almost entirely by the human papillomavirus or HPV, this disease claims the lives of thousands of Ugandan women every year. And behind each statistic is a mother, a sister, a daughter, lives cut short, families left grieving, and many communities carrying the weight of a loss. Today, cervical cancer is the leading cause of cancer-related deaths among women in Uganda, a crisis that is both urgent and preventable. At the Uganda Cancer Institute, doctors see this burden every day. For many women, the cancer is often found when it has already grown, treatment is difficult, and for many families, almost impossible to afford. On top of this, myths and fears make things even worse. Some people think that cervical cancer is a punishment or a curse. Others are afraid that testing or treatment could make them unable to have children. These misconceptions not only silence conversations around cervical cancer, but also discourage women from seeking life-saving care.
At the moment, there are about 35,000 new cancer cases reported annually, and we see up to 25,000 deaths from cancer. Cancer has affected all age groups in the country, with the leading being cancer of the cervix. This contributes 20% of all new cases. In other words, every one among 5 new patients diagnosed with cancer is likely to have cancer of the cervix. And it's the top cancer among women in Uganda. For men, prostate cancer is the leading. In that order, we've got breast cancer, cancer of the esophagus, non-Hodgkin's lymphoma, as well as gastric cancer. These are the top cancers within our population.
I was working in the hospital, by that moment, by that time. So I was like breathing, but not normally. I asked for a doctor. I was like, you check on me and you say, what is wrong? I'm not understanding myself anymore because I'm bleeding a lot. And he was like, okay, let me check here and we see some. Awo we natandikira okususpectinga nti no kirabika. Kuba if I told my mama about it, he was like, naye genda mu ddwaliro kiki? Kati nenkwate kuba nengende ewa doctor na nkebera nangamba Sharwa oyina ekizimba, namugamba it's okay. Nangamba gende ewaka tugenda kuwa results zo in 2 weeks. I was like, kale tewali buzibu. So nenzirayo ewaka nembere for 2 weeks. Results come out. Yeah, when I was cancer. I got shocked. For sure, kubanga we've been seeing it in the movies. Yeah, someone got cancer and the hair got off. I was like, am I going to be like this? Oh, I shouted. I was like, no, in this my young age, and I be with cancer. I started to catch in my head. At that moment, I was feeling like my hair is going out. For sure. Because every doctor was saying me was like, this girl is too young, but to have cancer cervix. I was like, hey, why are they talking like this? So the Solomon told me that it's okay.
We see kind of a proportional burden of the cases. As you know, Uganda Cancer Institute is the national cancer referral, and this means that patients from all over the country are referred here for care. So we see an accurate reflection of the cancer burden in Uganda. We also attend to patients from within the East Africa region, especially countries that are facing civil wars or some difficulties in care provision. We continue to see patients from eastern part of DRC Congo, a lot of patients from southern Sudan, as well as Sudan at the moment, a lot of patients from Eritrea, and several patients from a few countries across Africa that still come here. At the moment, the Uganda Cancer Institute attends to at least 8,000 new patients annually, and this is just a fraction of the entire burden within the country. Now, the Institute has got its main center here in Kampala, where we are, but also there are satellite or regional cancer centers. There is a center in Gulu, 300 kilometers north of Kampala. There is a center in southwestern part of Uganda, in Barara. There is a center in Arua at the Regional Referral Hospital, and currently there's a lot of political will and commitment to establish regional centers in Mbale as well as Hoima. So at these centers, the model is to provide a comprehensive cancer service. This includes the spectrum of cancer care, from screening, diagnosis and treatment, whether in form of surgery, chemotherapy, radiation, immunotherapy, hormonal treatment, palliative care, but also we provide research and training. So while the load looks enormous, there's a lot of support from the government to even reach further in all corners of this country.
After I was pronounced that I had it, I told people, my family, I advise family members and friends to be sensitive, to be positive. Negativity can kill. When I told people that they had I had cancer, everyone was telling me, Gloria, they tested you had no HIV. At least if you had HIV, it is better. Those with HIV can take that seed and continue with your work. But for you are going to be bedridden, what not? Then the people at home started saying, she's a good case. Who has ever survived the cancer? Who has ever? They are deceiving her. She's going to waste the money. Instead of encouraging me. But thanks be to God, I had my children. They encouraged me really. With the doctor give me with this one. think I thank God because of them. But otherwise, villagers started taking my little things. But I thank God I'm here. When you get cancer, please go to the hospital. People brought for me medicine. This would no matter what, herbal, what not. There's a time someone gave me, how do they call it in English? I don't know. I give even heads when they are sick, I don't know them. So they told me if I put it in water, I drink it, I'll be cured. I remember, told the doctor, he said, no, herbal is not bad, but we don't know the measurement. So please, Gloria, you don't know the measurement, you don't know, don't take it. Now, from that time, I swear I have never taken herbal. People abused me. People told me to go to witch doctors. But frankly, I stuck to prayer. And this chemotherapy and what? So, do you know that some people die because of being misled? I thank God people. I had this doctor to advise me and Dr. Demi. They would tell me, don't mix. And now I'm here.
Usually the challenge with the cancer treatment is that patients, especially in this part of the world, we tend to discover the cancers when they are at advanced stages. Now, the major thing I realized from the patients I used to interact with, why they would wait for certain tumors that are physically visible, that this is a tumor, to first exacerbate the situation, are myths, cultural beliefs. Now, some people think, up to now, they think that some of these cancers are actually witchcraft. Funny. And the only problem we are having is that our traditional healers do not make timely referrals to hospitals. These people first go to traditional healers, and when the traditional healer realizes that they can no longer handle it, that's when they now refer to hospitals. Try complementary medicine, try the Englishman's medicine. But by the time the patients come here, the thing has actually gotten out of control. Now that has shortfalls, but when we realize that when diagnosis is done at early stages and right treatment is given, right treatment including radiation therapy, the results are very excellent.
Yet amid these struggles, there is hope. The human papillomavirus vaccine, when given early before exposure, has the power to prevent up to 90% of cervical cancer cases. It is one of the most effective cancer prevention tools ever discovered. Uganda was a pioneer among the first African countries to roll out the HPV vaccine in schools, a bold step that has already safeguarded the future of thousands of young girls. Each vaccinated child represents not just protection from the disease, but the promise of a life where dreams are not cut short by preventable illnesses, but the journey is far from complete. Vaccine shortages, gaps in awareness, and deeply rooted myths continue to stand in the way. In some communities, fear and misconception keep families from embracing the protection the vaccine offers. In others, missed opportunities mean that girls never receive the doses they need. These challenges remind us that while progress has been made, the fight against cervical cancer requires stronger commitments to reach every girl in every corner.
In my role in the HPV vaccination, we have is to sensitize the children. We first sensitize the elders, because these children lives with their parents, relatives, those in the schools, their head teachers, or the caregivers. When they accept us to talk to their children, we gather the children, maybe in a class, in a tree. We talk about HPV vaccination. So we tell the girls about that virus, how it attacks someone, the dangers after someone getting it. So when they get the new information about it, that's when they allow us to get immunized. So we give them the first dose after getting the full information concerning about HPV vaccination. The same to the elders, those people who stay with the children, the elders who are between 21 to 49. So we talk about how they can get the cancer of the cervix, how they can get how they can get the cancer of the breast. So after getting the information about it, the signs and symptoms, how to manage it, so they get to know that managing it at early stage is simpler than managing it at a late stage. So that's why those people accept us to do cancer screening, cervical cancer screening and breast.
For women already exposed to HPV, screening can be a lifeline. With just a simple test, early changes in the cervix can be detected long before the cancer has a chance to develop. When caught at this stage, the disease is not only treatable but often curable, sparing women and their families years of pain and suffering. Yet in many communities, access to this life-saving tool remains painfully limited. In Uganda, fewer than 2 in 10 women have ever been screened for cervical cancer. And in rural communities, the numbers drop even lower, leaving most women unprotected. The barriers are many: long journeys to distant health facilities, the high cost of services, and the silent weight of fear. Fear of a diagnosis, fear of stigma, fear of the unknown. For many women, these obstacles mean that by the time they finally reach the hospital, the disease has already advanced too far.
Regarding the geographical barriers, I think the institution has made a lot of progress to ensure that there is access to cancer diagnosis in a timely fashion. I must tell you that we have a community cancer group, a whole department that conducts screening drives around the country in all corners. We've reached all corners of Uganda. We've done screening for the common cancers such as cervical cancer, breast cancer, but also screening for other types of cancers, especially prostate. This is already at the community level. Within the institution, there is an open clinic where patients can walk in at any time and see a doctor with any abnormal symptom, and they're evaluated both in terms of physical exam, imaging tests available, all the blood parameters available, and we have the expertise to really navigate care for this patient. So I think a lot has been done, but the next direction might need to focus more on the community to change the myth that cancer is a death sentence that affects health-seeking behavior.
For women diagnosed when the disease is already at an advanced stage, palliative care becomes essential. It's about far more than medicine. It's about preserving dignity, easing the pain, and walking alongside families through one of life's most difficult journeys. Palliative care offers comfort when cure is no longer possible, ensuring that no woman has to face her final days in unbearable suffering. Yet in many African countries, access to this care remains limited. Many health facilities lack the resources, trained staff, and medicines needed to provide adequate support. As a result, many women endure pain in silence, and families are left to carry the emotional and financial burden on their own. Expanding palliative care is not just a medical necessity, it is a moral obligation. an obligation to ensure that every woman, no matter where she lives, can face the end of life with dignity and compassion.
I was born here, and this patient was my sister. When I first learned of her illness, she was not very sick looking, but I figured she had no care or support, and she was afraid to disclose her condition. But I approached her gently and asked what was wrong, and eventually she opened up to me about her condition. I reached out to the Kitovu Mobile people. They provided her with treatment, but over time her condition worsened drastically. She became unable to sit or bathe and eventually was bedridden. The pain intensified. She had cervical cancer. With that knowledge came immense stress. She had no source of income and no resources to manage her illness. Traveling from medication was expensive, and she needed to go back and forth constantly. As her only caregiver, I had to find ways to source money and support to meet her needs. When her illness became severe, her husband wanted to sell the house she was living in. As the caretaker, I advocated that he should not sell it because she deserved to live in a clean, spacious environment during her final days. Despite the efforts, after her death, he sold the house and the land just 2 days later. In her final days, she was suffering terribly, bleeding heavily with pus and a severe bad smell due to the progression of the disease. Before we connected with Kitovu Mobile, no one was willing to come near her. After they intervened, she was given medicine that helped reduce the odor and managed some of the pain, but it was too late. She died in agony within a few days. Ever since, her condition worsened. On my watch, my life has not been the same. I try to distract myself with work, but whenever I'm free, her image comes back and torments me. Seeing her face floods me with pain. Losing her has left a deep, persistent wound. She was my sister, just her and me. This experience has affected my mental and psychological well-being.
First of all, we must add our voices to the voices of communities, increase awareness about cervical cancer, emphasize that this disease is totally preventable, and how can we prevent it? By scaling up the access to HPV vaccination services, by empowering women to screen and rescreen for cervical cancer as needed, and this will come with integration of services. If a woman has come for this service, why can't she have her cervix and possibly also her breast screened? Because if we detect the changes on the cervix early, we can intervene and save this woman from cervical cancer. So HPV vaccination, screening, and then early treatment Sometimes women get referred to these cancer care centers and they spend close to 4 months in that channel rotating around, and treatment has not been initiated. And God forbid, by the time she gets to see an oncologist, the cancer has spread. So can we make the care more timely? And how can we do this? Governments should deploy more oncologists, and let us have fair distribution of these services. They shouldn't be centralized in urban areas, but let's also go out to the rural areas and also at primary health care level. And let's have the investigation services affordable. Sometimes people can't afford these biopsies which are required to confirm diagnosis, and you find a woman or girl rotating around when something could have been done if the diagnosis had been confirmed earlier. I look at these as some of the key bottlenecks. And then also the treatment should be affordable or even free, especially for the pre-cancerous lesions. Let that treatment be free. And also the treatment for cervical cancer. It is very costly, and almost 0.5 of the women can afford it. So I urge member states to make this treatment free and available.
Eliminating cervical cancer is within our reach. The World Health Organization's strategy is clear. By 2030, 90% of girls should be vaccinated, 70% of women should be screened, and 90% of those diagnosed should be treated. Meeting these targets will save thousands of lives and spare mothers, daughters, and sisters from a disease no woman should die from.
My message would be screening. For my neglected screening, I did it really. I did it. So people should start going for screening. And don't take anything for granted, fellow women and girls. Young girls go for screening. If they found out when it is not yet very late, I think the treatment can be cheaper, lesser, to not take time, and not to go through what we went through.
If you see anything on your body which is not like, which you are not understanding it, you just go to the doctor and they recognize you, then you come for a treatment if you are cancer, if you have cancer. If you see that water or the blood which is not normal, yeah, you can go and see the doctor.
Dear governments of the member states in Africa, this is women health. Women make a significant contribution to economic development in Africa, and we are going to have strong families if our women are healthy. Let's avail cervical cancer screening and treatment services, because if we screen the women, if we treat them early, the burden of cancer is going to go down. Let's avail the medicines required, and let's make the investigation procedures affordable. And I look forward to an Africa that is free of cervical cancer.
Cervical cancer is not a death sentence. With vaccination, screening, treatment, and palliative care, we can build a future free from cervical cancer. Together, let's give women and girls a gift of life, health, dignity, and hope.